Alright, welcome back to another episode of Change Talk. Here comes arguably one of the most scrutinized and perhaps undervalued diagnoses in the DSM. Attention Deficit Hyperactivity Disorder. I hear what you're saying. Don't you mean ADD? I do. However, the term or diagnosis of attention deficit disorder is dated. In order to simplify things, ADD added an H after the first D to help cover the three subtypes of inattentive, hyperactive, and combined types. Attention deficit hyperactivity disorder has a very bum reputation. In fact, there are some well-known mental health professionals that don't even believe ADHD is a real diagnosis. But then again, what is a real diagnosis? Our diagnosis system, by definition, is made up of criteria of real symptoms that are negatively impacting a client's life, usually at home, work, or in school. Yes, we have a fancy way of neurotesting that measures brain waves and centers of the brain that are activated or underactivated that correlate with an ADHD diagnosis. But similar areas of the brain function relatedly for other diagnoses, such as post-traumatic stress disorder and even depression. So how does a person know for sure if you have it? Well, the short answer is that even with all the tests, functional magnetic resonance images, and pen-to-paper assessments that we have, we aren't even completely sure of what things cause ADHD. We have empirical research indicating a correlation with etiologies, or the root causes for the disorder, but we are not talking about just one cause. There are theories stemming from poorly communicating hemispheres of the brain, through the corpus callosum, that fiber optic cable that connects the two hemispheres, DNA usually passing through the father, that is left-brained or highly analytical, poor parenting practices, trauma, a dopamine deficiency, brain constantly attempting to prevent itself from falling asleep, ADHD being the highest form of autism, or children's prefrontal cortexes, that executive functioning part of the brain, are about 3.5 years behind development. So which one's true? Well, each theory actually has its own sound argument in supporting research. How your child or loved one developed ADHD will be relevant in the distant future when we have more targeted interventions for it. For right now, however, you have several options under the premise that standard counseling interventions are likely going to target various components of the disorder. Pretending there is nothing wrong with your child, despite being the wrong course of action, will always be an option for parents. Did you know that it is believed that ADHD is overdiagnosed in boys and underdiagnosed in girls? Part of this theory behind this general principle is that teachers are the first ones to notice something is up, typically, in the school system. And boys that have ADHD are more likely to act up behaviorally and get noticed. Girls, on the other hand, that have ADHD can be better at concealing it. Sometimes girls with ADHD come across as being depressed or anxious, typically because they don't have many friends or are failing at their academics. But then again, remember the whole autism epidemic that you heard about a decade ago, when researchers were startled that the rates of diagnosed children with autism were skyrocketing. The most accepting theory behind this is that we have come a long way in assessment analysis and are able to detect autism more accurately and at earlier ages. Not people receiving vaccines like Andrew Wakefield, among others, that deceive the world into believing. However, the diagnosis of ADHD is very sound and affects many people in a very negative way each and every day. People with ADHD are more likely to do poorly academically despite there being little to no correlation on their intelligence. Persons with ADHD sometimes suffer in long-term relationships due to their impulsivity. Individuals with ADHD find challenges associated with immediate gratification, where they are less likely to go on to higher forms of education or push themselves academically. Children with ADHD typically have little to no friends and can be seen as an annoying class clown that is unpredictable. Persons with this disorder are at higher risk of developing a substance misuse problem. And people with ADHD are more likely to have what we call a comorbid diagnosis to go with it, such as a sensory processing disorder, social anxiety, and especially oppositional defiance. So, What are our options? Well, believe it or not, there are a lot. If the ADHD is manageable without professional interventions, sometimes just becoming more organized and having a stronger support system is all a child needs. And he or she may eventually outgrow ADHD, like very roughly half the ADHD population. Option 2 is to see a specialist, like myself, that can teach self-control strategies, educate the child about the disorder, help develop the child to be better at communicating, foster a heightened sense of emotional awareness, leading to self-regulation, instill an accurate use of empathy, help turn external locus of controls to internal ones, teach attention-building activities, channel that poking reflex, or pushing buttons desire of your child into something more productive. And the list goes on and on. Remember that PTSD video where you got all excited talking about eye movement desensitization reprocessing and related interventions? Well, EMDR is to PTSD, as is neurofeedback training is to ADHD. Neurofeedback training was first developed in the late 1950s and early 60s through the work of both Dr. Joe Kameya at the University of Chicago and Dr. Barry Sternman at UCLA, involving NASA, cats, and rocket fuel. Freaky, I know. Check it out if you are interested in learning more. Through the years, this model has been redefined, and the old school photographs with a computer the size of a room and dozens of electrodes has become much more refined. Today, there are more strategically placed electrodes and have several more options available, such as headbands they can purchase yourself, replicating a quasi-neurofeedback kit if you have the $300 to shell out. In order to explain the premise of how neurofeedback works, let me describe a previous experiment involving monkeys that were blindfolded. After being blindfolded for about 2 weeks, researchers were astonished to discover that the parts of the visual cortex were beginning to become active again. That is, of course, with the monkey still being blindfolded. So the cliff notes of this experiment would be that the research indicating that when parts of your brain are underutilized, that various other parts of your brain begins taking up that valuable real estate. This could also indicate that conditions that are neurodevelopmental, such as ADHD, can potentially be circumnavigated through similar rewiring process. Now, does that mean there is hope for individuals with acute brain injuries or major head trauma? Not so much. The brain does create new brain cells, such as in the hippocampus, but not nearly as fast as required to compensate for most injuries. Even with ADHD, regions of the brain having to do with attention and impulse control will always operate more efficiently than regions of the brain that were not developed for this task. Sort of like neuro-MacGyvering or jerry-rigging of the brain. Will your ADHD symptoms be alleviated or greatly reduced through neurofeedback? Perhaps. Will this intervention be semi-permanent? It's likely. Will my son or daughter learn to be respectful and stop pushing my buttons? Fat chance, without other interventions such as psychotherapy, which operates in a similar capacity. However, neurofeedback, that is, of course, if you can find a practitioner that even takes your insurance, does offer a real alternative to stimulant medications that curb your appetite, sometimes cause teeth grinding, and sap the water right out of your body. Complete with lovely mood swings that occur during withdrawal from the medication, usually around 5 to 6 p.m. at night. Now, is that saying that medications are a bad alternative? Absolutely not. In fact, they are the most likely intervention that you are probably going to pick after this video. Why, do you ask? It's a quick band-aid approach, extremely effective at treating your child's symptoms, and is a relatively safe option under the care of a physician. Now keep in mind, I am not a medical doctor and do not practice medicine. This information that you're hearing from me can be found in most related books, research articles, and online websites. Even considering amphetamine-like options, such as the recently developed Vyvanse medication, could be a very lucrative option after speaking to your doctor. One could argue that this medication is perhaps one of the most popular ADHD medications on the market, due right now to it being one of the first prodrugs of its kind. meaning that it doesn't turn into a stimulant until it is metabolized by your body. What does this all mean, Basil, you ask? Well, many of the potential for addiction and or side effects of medications surround how fast your body can keep up processing the medication. Typically, this is done either through your kidneys, liver, or both. Vyvanse is an amphetamine-like substance that gets released in your body at a rate that is more closely resembling your own body's capacities. A better way of describing this is to talk about another popular drug, Adderall. Adderall, for persons who are addicted to the substance, is the amphetamine-like drug of choice, since it is more rapidly released and contains a mixture of amphetamine salts. Does this make Adderall a bad option for some children or adults? Absolutely not. At the publication of this video, Vyvanse currently does not have a generic equivalent. And if you're lucky with your private insurance and manufacturer's rebate, you might be able to get a monthly supply for around $30, as opposed to Adderall for probably closer to $5. In addition, Adderall is shorter acting and comes in extended release formulas. This means that, let's say you just need to take an amphetamine for a class in the morning, or for an interview, public speaking engagement, whatever, and you want to reduce the amount of amphetamines in your body, this is one way to do it. Lastly, there are non-stimulant versions as well, such as Intuitive, that are really blood pressure medications that researchers found to be beneficial for ADHD. In addition, there are also many off-label uses for epileptic and selective norepinephrine reuptake inhibitors, SNRIs for short, that correlate with acetylcholine, dopamine, and norepinephrine, neurotransmitters that are associated with various forms of ADHD. However, many of these medications should be used as a second choice with children due to our limited understanding on their actions inside a child's developing brain. Hence the term off-label, which typically means that there is yet not enough evidence to support this medication being used in a primary capacity for said diagnosis. Slowly over time, this becomes less of a case due to many drug manufacturers seeking new patents for old drugs that eventually get approved by the FDA. Diet is also something you need to keep an eye on with ADHD. Certain foods, such as highly processed foods, have been known to cause autistic-like symptoms in lab mice. That's right. Your diet and overall nutrition certainly can affect your mental health in a negative way. In addition, you have heard me say in previous videos that being hangry is often caused by glucose levels dropping in your body. Well, guess what? Having lower blood sugar levels in your body also drives your brain towards losing focus faster. Believe it or not, and an intervention that I typically suggest to parents is to give their child dark chocolate to consume right before a major exam. Why? Not only does this help raise the blood sugar levels in the brain, but for that half ADHD population you heard me talk about, the caffeine can also help some children focus better. Remember that your brain generates roughly 13 watts of electricity, which is very roughly the capacity of a standard fluorescent light bulb, or a really bright LED bulb. Hence, one of the reasons why Change Talk LLC utilizes a light bulb as part of its logo. That amount of electricity requires a lot of calories to sustain. Due to this high energy consumption, the brain is also one of the first organs to suffer when calories and blood sugar is scarce. Probably the last feasible option you wish to choose surrounding tackling your child's ADHD is some of those free attention apps that they have for tablets and cell phones. However, typically this is the least effective option, although it should be considered as an add-on to various treatment options with an approval of your mental health professional. The last thing that generally greatly interferes with ADHD symptomology is quality of sleep, which generally also exacerbates most other forms of mental illness. When it comes to tips on that, check out our wellness video that covers sleep hygiene practices. So that's a lot of information, am I right? So to recap, the options you have certainly include speaking to your primary care physician, doing neuro and psychological testing, seeing a therapist such as myself, taking medication, watching your diet, exercising, peer support, keeping an eye on your blood sugar, those phone apps, sleep hygiene, neurofeedback, and the list goes on and on. ADHD, if properly treated, typically has a really good prognosis. And like previously stated, the sky's the limit towards options that you have. Stay tuned next time for a discussion on perhaps one of the most revered diagnosis class in the DSM, personality disorders. See you next time, and thank you for watching.